21st Emergency Services Council meeting.
I'm going to do roll call. Atherton,
Kerry Weist here.
Belmont, Brisbane, Burlingame. I know she's here, right? Colma, Daly City,
Len Sylvester, present.
East Palo Alto,
Lisa Gaucher here.
Foster City,
Richa Wasti here.
Half Moon Bay, Hillsborough, Menlo Park, Millbrae,
Ann Schneider present.
Pacifica, Portola Valley,
Don Richards, present.
Redwood City,
Janet Morgan's present.
San Bruno, San Carlos, San Mateo,
Joe Goethals.
South San Francisco, Woodside, County of San Mateo.
Here. Thank you so much, Madam Clerk. Before we move on to the next one, I'd like Rico Medina, the mayor of San Bruno, to lead us in the Pledge of Allegiance.
Muted.
You can unmic yourself. Unmute yourself.
Thank you. Thank you for rising. And please join me. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, folks.
Thank you very much, Mr. Mayor.
Through the chair, just want to check in that Hillsborough is in attendance.
Great.
And also Menlo Park, Cecilia Taylor.
And Brisbane, I don't know that you got me. My mic was muted.
And Burlingame, I think my mic was muted also.
I have everyone now. Thank you.
All right. Thank you very much, everyone, for participating in this meeting this evening. I just want everyone to have the opportunity to hear the latest updates and what the county is doing in this COVID-19 pandemic. As all you know, the latest health order was released on the 15th of May and was effective on the 18th of May. This order basically coincides with the governor's phase 2 order. In order to move forward, we will need to meet certain COVID-19 indicators. These milestones will determine whether there will be modifications, ease restrictions to the health order. Some of those indicators include the capacity of the hospitals in the area, such as the number of ICU beds available and acute care beds, the supply of PPE, the ability and capacity to test. Luckily, we've been able to add 2 additional sites this week, and the ability to conduct contact tracing. Hopefully in the near future, we can move through all phases in a safe manner and get our local economy back on track and have everyone back to work. Tonight, we'll have an update on the health system from Luis Rogers, our health system chief. Secondly, we will have Lisa Mancini, the Director of Aging and Adult Services, who will focus on the services and programs that have been implemented during the COVID-19 pandemic, especially the recent Great Plates program. We will also have another county update by Mike Callaghan. Finally, there will be a discussion on concerns regarding the public safety power shutoff by Chief Dave Pucci and OSHA. I know that we touched upon this issue at our last meeting and thought it's worthwhile to continue the discussion. And so with that, let me introduce item 3, our health system update with Luis Rogers. After each item, we'll have a question and answer section. So with that, Ms. Rogers.
Thank you, Supervisor Canepa. Good evening, everyone, or afternoon. I thought I would start with a very brief update and then really focus on the contact tracing that we're ramping up in the county in order, as Supervisor Canepa mentioned, in order to meet the the measures, one of the measures focuses on contact tracing and being able to pursue all of the cases. But before I do that, just briefly, we have 1738 cases in the county. And I do want to mention that we were finally able to publish to our website the distribution by race and ethnicity of the positive cases. And of course, there are a large number of unknowns, but I hope over time that people who are being tested and people who are collecting those specimens will encourage everyone to actually complete the race ethnicity information, because it can really help us understand a lot about what's going on out in the community. And right now, about 40% of the respondents they choose not to share their race or ethnicity. So I think we can do better than that. But the data is up there, and I'm hopeful that over time it can help us learn. We also have published, for the deaths, we've unpacked the Asian group that often includes Pacific Islanders, and we broke them out separately, so that's good. And actually, there have been no Pacific Islander deaths in the county. And on the cases, there have been 15 positive cases so far of Pacific Islanders. So I just want to mention that, but you all can monitor it as well on a daily basis on the website. So we have completed in the county collectively, hospitals, healthcare systems, the VIII project baseline testing sites, public health, et cetera, 24,054 tests, and 7.2% of them were positive. And as testing continues to increase, of course, we'll learn a lot more about the spread of the virus. And it will also greatly increase the number of cases. I mean, there's just no question that we'll identify more cases, because there are many people, as you all know, with this virus that are asymptomatic and don't really even know that they have it. So I am expecting that we'll continue to see those numbers grow. They may not grow as a percentage of the total number tested. We might see the percentage drop, but the number of positive cases is certainly going to grow. And so then we're really going to need to, with every case, do contact tracing. And so contact tracing is a long established public health practice. Our public health division of health, in a given year is looking at 87 different communicable diseases and tracing contacts. That's just kind of a core function that they have. It's just that fortunately, it's never at the scale that we're talking about right now. So in a normal year, they would be looking at measles, they would be looking at HIV, STDs, TB, and now COVID-19 has really raised the need to do contact tracing to a whole new level. And so normally we would have about 8 people in the communicable disease division of health focused on this need to contact trace. And we actually have a county civil service classification for a communicable disease investigator. And they are very skilled at interviewing people. A lot of the work happens over the phone. And understanding who those people were in contact with in the recent past. And so they really have to be skilled at engaging people's trust. And as you would expect, they need to be able to speak various languages in this county, especially. They need to be culturally competent. The most effective contact tracers are going to really be able to engage people's trust, right? Because you don't want to talk to someone about what you were doing in the last few days unless you trust them. And so it's very confidential. It's a highly confidential process. So as we looked at, well, how are we going to ramp up? We considered what are the skills that are needed. And we realized that there are many different county classifications and personnel that could be very skilled at this. It requires a high degree of customer service, ability to engage trust, as I mentioned, managing confidential information, using software. And people do have to have a basic understanding of a communicable disease, but it's something that you could learn, and you really don't have to have expertise in it if you are working with a team that has that expertise. And the work does happen 7 days a week, because although much of it happens Monday through Friday, the follow-up on the weekend is very critical. So we asked ourselves, how many of these contact tracers do we need? We took the original 8 that we had that were employed by health in the CDI classification, and we ramped up to 30. And we did that by redirecting other health staff, including public health nurses in particular. And we at this time are getting 28 new positive cases a day that we need to track. And the capacity that we have can take us up to 60 cases per day and tracing all of their contacts. In general, one contact tracer should be able to handle 2 cases a day if each of those cases has 10 contacts apiece. And so looking at what the state was expecting of us, as well as a lot of literature and advice on the topic, we targeted that we should get up to 115 people, which would be 85 people more than we have. And that 115 could help us actually track 230 new positive cases per day. So with the kind of testing that we're hoping to achieve, we may actually need to get to those numbers. It won't happen overnight. And so we're working with county HR to develop a job description and a process. And of course, we'll be working with labor. And the goal will be to identify a first group by July and a second group by the fall. And we'll train them up and have them ready to go, but we won't pull them from their usual work unless they're needed, unless the actual number of cases in the county requires that degree of tracking. But it's really essential that we be able to do this work, because it's the main way that you manage the spread of the disease in a scenario where society is more open, which it won't be soon, but it's already more open just by our more recent orders. And the way that we manage and control the virus is really by learning about positive cases and then pursuing all of those contacts and then isolating people and quarantining. So I'd be pleased to answer any of your questions about this or anything else related to the health response.
Okay. Are there any questions for Louise?
Yes, Mr. Chair. I submitted a question on chat.
Okay. Jeff, can you read that question for us?
Okay. Any update on the county in considering the use of contact tracking app? This was a suggestion from about 2 weeks ago. It appears that the human element in the bottleneck.
There are a lot of different contact tracing apps, and our first priority is to, we already have 2 applications that we've implemented for contact tracing, and we're also comparing what we have to what the state has. So our first priority is to get all of that established, and then it's possible that we would evaluate using a more general app. There are a lot of concerns and issues with the apps that are out there right now that don't align really perfectly with public health requirements around confidentiality. But I certainly wouldn't rule it out. And I think the technology is moving at such a fast pace that it's, it's possible that there will be some opportunities that do meet public health requirements and could be really, really useful. We're just not there yet.
Thank you.
We also have a question from Vice Mayor Ann Keegren, if you'd like to go.
Louise, I have a quick question. Is there a possibility that we can have a separate category in data that shows the amount of people who have underlying chronic health conditions?
I'm really interested in that question, and my focus has been on understanding that with the deaths.
Yes.
Which is actually a pretty big lift. It turns out that that to really understand a death involves really looking very closely at the medical record, which I'm sure you, as a nurse, as a former nurse, could understand some of the complexity. But We are hoping to be able to do that kind of analysis at least for a sample. At this point, from what we know to date, it does appear that our experience is very similar to the nationwide experience, which is that the vast majority of people have underlying medical conditions. But the way it all gets reported on the death certificate and all of that, you don't necessarily see very easily all of that information. So it takes some work. I don't think that we're necessarily going to be able to tell that for the positives right away. It's not information that we would be able to collect except through the investigation and in a data system. But I wouldn't rule that out either for the future. It's just that it's not right now something that we can easily, analyze from a data perspective. But I would hope that with the deaths, we can make more progress.
Great, thank you, Louise.
And thank you. Councilwoman Oswathi, if you want to unmute yourself.
Sure, thank you. I just have a question with regards to any thoughts on the success measures of the contact tracing approach. Is it possible to, after a certain number of weeks or months, make sure our approach is heading in the right direction? And if not, is there a potential to pivot or course correct, or we are certain that this is the approach and it has worked fine in many different situations and it should work fine?
Well, contact tracing is a whole specialty within public health that is, fairly well defined, and that is guided by the CDC. And so our goal has been the measures that the health officers and the state set out are that we should be able to engage 90% of the people who are positive and track 90% of their contacts. And so we're going to be focused on accomplishing those measures. But it sounds like you're asking more about, whether the methodology for contact tracing, is, whether it's a good methodology.
Yeah, so many of the things that we are learning about, COVID-19 is unprecedented, right? We have not seen or experienced any similar thing in the past, and whatever tools we have, based on the past learning and methodologies, we are putting that in place, which I think is the best thing to do. And the way you describe the process and engagement of the resource is top notch, and I'm fully confident. What I was kind of urging us to think whether there is a way where we can evaluate, whether we need to do something more or something different, just because of the nature of the virus, right?
Well, no doubt, the nature of the virus, and also, frankly, just the scale of this is so unprecedented and so beyond. And so I'm very much in support of we need to learn from the process and also, continue to ask ourselves, is there a better way to do this? And so, for example, that earlier question about the contact tracing app, could be a pathway to find a better way to do this, right? And so there may be other ways as well. So yeah, I really agree with you that we have to keep evaluating this, and as it unfolds, determine, is it really working? Is it getting the job done?
Perfect. Thank you.
Great. Thank you. Councilwoman Borgens, you're next, if you want to unmute yourself.
Thank you. I had a question, and you may have explained it and I might have missed it, but how is the tracing done or tracking done for a disabled community, our hearing impaired, our blind community, our emotionally disturbed, our homeless community? How is that done?
Well, it all still starts with establishing trust, right? And so I think the examples that you have raised point to that has to be done in different ways with different people. And so we do have to have, for example, we have to be able to engage people who are hearing impaired. We have to engage people in all of these accessible ways, and we need staff that can assist us with that. And we may, in some examples, we may need to have ASL interpreters, there are all sorts of things that we need to do, but it all starts with being able to establish trust with the person. And it can be very challenging when the person, often it's not the person who's actually positive, but when the contacts, maybe less interested in engaging. The health officer's orders carry a lot of power, but that isn't necessarily the way to engage someone to want to talk to you. So we always want to start with approaching the person where they're at, ideally in their own language and in their own, kind of culture. And, I'm hopeful that with the breadth and diverse array that we have in county staff, that we may be able to use folks that already have experience with different populations. For example, people who have experience with people that have addictions or mental illness might be well equipped to be the contact tracers for those populations.
Great, thank you. Mayor Sylvester, if you'd like to unmute and ask your question.
Yes, basically this was a follow-up from the original question. I guess we got a little bit off the tangent. Again, we in Daly City talked to a particular person who created the app called Contact Tracing. I'll put a picture of it in the chat a little bit later on during this meeting. I do understand the HIPAA concerns, but at the same time, I think we ought to offer the public a mechanism if they want to sign on just to protect themselves and others, and just know this app tracks where you've been, and it's similar to the app on Waze that we use, and basically it's crowd-sourced. And so if anything, I would hope that San Mateo County and the folks in the powers to be at least consider. The programmer is very, very flexible, and things can be modified, and no need to reinvent the wheel if the app is already there. So just
I think the challenge is that there are a lot of these apps now, and I think for the county to, invest resources, there would need to be some kind of a competitive process and evaluation, because there's so many different versions now and apps, and people are sending us a lot of these business opportunities kind of on a regular basis. And so I think they have to be evaluated, they're going to have to be evaluated somehow, because we just get so many of these. I can totally imagine it would be helpful. And I think there may be some things that the public would choose to do, just on their own. They're free to do it. And I think there's a lot of products where that's going to be a possibility. And then there's other products where they're needing something, they're needing endorsement, or they're needing data, or they're needing approval or a blessing. And that's where it starts to get really complicated, because there are a lot of companies approaching us, all the time about this. But these ideas all have their time, and I mean, I can see just from the number of them that, it'll have to get sorted out. We're pretty stretched right now, just getting the basic job done, getting the applications implemented that we actually have to do to just kind of run the operation. And we don't have any staff who can be evaluating, these other kinds of applications. I do know, that they're out there though, and I hope as time goes on, or maybe we can learn from other counties, maybe we can learn from other jurisdictions.
Thank you so much. At least it sounds very promising. Thank you.
Well, the innovation that's been happening in order to help people, it is very.
Great. Are there any other speakers, or are we ready to move to our next item?
We have a question from chat from Marie Cheng. In addition to tracing when a COVID-19 case is confirmed, how do you notify people who have come in contact with that person?
Yeah, well, so that's part of what happens is a very intensive interview with the person who's positive in order to evaluate who among their contacts actually is at risk and needs to be quarantined. And there, you know, the CDC has guidance for every disease regarding exactly what kind of contact was significant enough, you know, the frequency, but also the length of time to create that kind of risk. And so the interview leads to the evaluation of to what extent the contacts were at risk, and then those contacts are engaged in order to ask them to quarantine, basically.
Thank you, Supervisor Canepa. No more questions.
Great. Thank you very much, Louise, for taking
Thank you.
That brings us to Aging and Adult Services update. Lisa Mancini. Ms. Mancini. Please unmute yourself.
Thank you. Thank you, Supervisor Canepa. I believe I have a PowerPoint that Jeff was going to be sharing for me. Is that available? Great. Thank you so much. I just want to take this opportunity to thank you. It's Older Americans Month, the month of May, and really want to do a shout out to our older adults in our county who were early adapters of shelter in place and have really continued to shelter in place, helping us to flatten the curve in San Mateo County. So very grateful for all of our older adults. We can go to the next slide. Just wanted to share with you Aging and Adult Services, our current state. We continue to remain open as there are some services that are essential that require a face-to-face, and so we do have our front lobby open. Most of our staff, 95% of our staff are working remotely, where we're making telephone and video call visits with our clients. We're making over 7,000 calls to all of our clients that we see in Aging and Adult Services. And the only time we are going out for home visit for like our adult protective services when there is an imminent risk of health and safety. But again, our staff are just doing an amazing job of keeping in touch with all of our clients who are in need. So next slide, please. What we're seeing, especially during the sheltering place, it's drastically increased the need for us to connect with our older adults. Isolation and loneliness is one of the top areas of concern that we're hearing about. So what we have done, as I mentioned, we're still reaching out to our 7,000 clients, but above and beyond that, we have a group of volunteers within Aging and Adult who are doing what we're calling friendly check-in calls for those clients who are at the highest risk. Who are vulnerable, who are living alone, feeling very isolated. And so we have a group who's making these calls to these clients on a regular basis. And also our community-based organizations have really done an incredible job of reaching out to their clients. These are our senior centers, our cities, where normally the residents would come into a facility, into a senior center, and what's happening now is they are making calls daily. And so what you see here is there's about 780 calls that are being done on a weekly basis to our seniors who are remaining at home. Next slide, please. Outside of isolation and loneliness is food insecurity. Again, our nonprofits are just really going above and beyond. They used to have the congregate nutrition where folks would come into a setting to receive meals. And now they've done grab and go for those older adults who are able to get out and pick up a meal and then go back home and shelter in place. However, there are so many that are fearful of leaving their home or just are unable to. So we are delivering 1,412 home delivered meals. And I just want to remind you that pre-COVID, we had a wait list of 586 folks who needed home delivered meals that we were unable to provide. So what you're seeing here is all of our cities, our nonprofits who are assisting in delivering meals when they normally don't do that service. We're so grateful for partnerships in this area. And we'll go to the next slide, please. And as Supervisor Canepa mentioned, we have our Great Plates Delivered program. I know many of you have heard about this program, so I just want to provide you a quick timeline. This is an emergency food program that our governor had reached out to FEMA. We were the first state to develop this program. So it's a partnership with FEMA, with the state and local counties. On April 24th, Governor Newsom made his announcement at his press conference, and it was, 3 meals a day will be available. And he said, if you're hungry now, hang up and call 211. And this was before we really knew about this program. So our hotline just pretty much just exploded with a lot of calls coming in. So around April 29th, we received the guidelines of how to actually put together this program, and we began really taking official referrals at that point. That following Friday, we released a survey, medium-sized restaurants in our following Monday, we received over 250, and then on that Wednesday 6th, we selected 30 to start this bandwidth to contract, because we need to do a full contract. And so we restaurants. See, on May 8th and 9th, we began our, whoops, I think we skipped a slide. If you could go back one, please. And is there a next slide then? Following this one? There it is. Thank you very much. So once we started actually hearing the need and feeling the need, we started serving clients. But I want to remind you of what the eligibility criteria is. It's for those who are 65 or older who are sheltering in place, and also for those between the ages of 60 and 64 who are at high risk and have underlying health conditions. The applicant cannot receive any other federally funded programs such as Meals on Wheels or CalFresh, who can provide meals. Program does go to the 600% of federal poverty level. So income needs to be under about 75,000 for a single, and for two in a household, 101,000. So as you can see, these numbers have already increased from when I sent this PowerPoint down yesterday. For our eligible participants, as of tonight, we are at 993 eligible participants. And of the restaurants, the participants matched in restaurants, that number is now 935. So you can see how in one day the increase, the restaurants, we are at 4. We have reached out to over 90 of our restaurants now, because we realize we want to expand this program, because this is also to be a stimulus restaurants in our community. What we're learning through this process is there's been a huge need. We have a lot of food insecure older adults who haven't come to the eyesight of aging and adult services because they might be in that middle income senior range. And we're learning so much. We're hearing, some of the stories we're hearing are, this one woman was down to eating ice cream that was left in her freezer and just wasn't sure how she was going to get through the following week. Just numerous stories, and our staff who are working on this, we have greater than 30 volunteers of our aging and adult services staff. And as I said below, aging and adult services is running at 100%. We're taking care of all of our clients, but we're asking for volunteers to take on additional work and to reach out to all of these clients. We also have the Office of Sustainability, our library system, the Health Plan of San Mateo, and the support from our county manager's office, who are also assisting us in all areas of this program. It's a wonderful program. We're hearing positive comments from restaurants that they were just so grateful for 2 reasons. One, that they could serve a community that truly was in need, and then also that they were able to hire back their employees and get their businesses back up and running. So it's a fabulous program. We're very honored to be administering it in our county, and I'm just thrilled with it. So moving on to our next slide. So we also have our in-home support services program, and we're partnering with the state, who has provided us with 2,795 masks and gloves, pairs of gloves, for our providers who are the caregivers who go into the homes of our 6,000 in-home support services clients. With that, due to COVID, we have had some caregivers who either have become sick themselves and don't want to go in and take care of someone, or some of our providers are just a little concerned to even go into some of our clients' homes. So we've developed an emergency backup registry where right now we have 63 providers who are available kind of at the drop of a hat to be able to go into a home and care for our providers. So we're very proud of the so quickly during this time. And also our in-home support services, they are paid through federal, state, and county $14.25 an hour. And to be on the emergency backup, it's an additional $2 an hour. So bringing them up to $16.25. So we're very thrilled that we have that program as well. And to the next slide. We also partner and contract with our ombudsman program. There it is. And who support our congregate living facilities. And they are reaching out, they too, along with their volunteers, are making phone calls on a daily basis to the residential care facilities for the elderly and skilled nursing facilities in our county. And they have reached out to over 9,000 residents, patients, and families just to provide them with information and to hear what concerns and issues might be coming up during this time of shelter in place. And as we know, our skilled nursing facilities and most of our assisted livings are having a no visitor policy, which makes it very hard for families. It makes it hard for the staff there because they know that the family and friend interaction is so important. So we're trying to do the best that we can through our ombudsman to support all areas of these congregate facilities. And then to my last slide, which is just talking about resources, the resources that we have for our older adults to learn during this time. Obviously, 2-in-1 has been a wonderful resource. Our county's website, also our Aging and Adult Services website, and our network of care are all areas where one can learn about what services are available during this shelter-in-place time. And then if I could just call out our hotline, which is 1-800-675-8437. That is just our normal where we receive our abuse calls and our information and referral. And we are also using that for our Great Plates intake line. And just to give you an example, pre-COVID, we averaged about 60 calls a day. And on Monday, we received 431 calls. So that just tells you where the need is out in the community. And really grateful to my Aging and Adult Services staff who are all volunteering to participate on these lines. So with that, I'm happy to answer any questions.
Thank you, Lisa. Vice Mayor Schneider, if you could unmute yourself.
Hi, thank you. And I assume you're going to send the slides out. I have a couple of questions. Yesterday on our elected officials briefing call with the update of the long-term planning, the slide that was shown identified a number of communities in the county and a number of demographical groups that are being looked at with an equity lens. Seniors were not part of that. And that makes me concerned. I think all of our cities have large senior populations. And at least in my household with a 62 and a 92-year-old, we are assuming shelter in place at least through 2020 and into 2021. So that means that the people who support us, or if I get sick, who supports my mom, it's going to go for a long time. And your volunteers tend to disappear over time. So I'm concerned that seniors aren't listed as a demographic group that's going to need special attention. But then my other questions are more for you with the program. Yay, thank you. I know at least one of our restaurants is getting it. Thank you for the meals to the people of Millbrae. Do our seniors have the choice of choosing between a couple of restaurants, or if they choose one, is it all that food forever?
Thank you for asking that question. Yes, there is when we work with matching the recipients to the restaurants, we offer 3 choices, and then the recipient is choosing that. Right now, what I also didn't mention is this program is funded through June 10th. The state of California has requested 30-day extensions, but we are not aware if that will be approved or not. So we do know it's through June 10th. And our plan through June 10th is just to have the senior use have the restaurant that they originally chose. Just really because it's a administrative task, and we're closing in on 1,000 participants, which we're very happy about. But we did want to offer choice from the beginning.
Excellent. And again, none of this is a criticism. It's just curious on that. I would love if you had or put together something that me as an elected, maybe the other electeds, can reach out to our community and identify those gaps where some of our other groups might be able to step in. So for example, it was over 2 years ago that I went out with Meals on Wheels. They had just started serving Millbrae. They had no volunteers from Millbrae serving the meals in Millbrae. So thank you, Redwood City. You were serving our meals up here. But I'd love to get our people here involved in that program, because that program on that. I know that our Lions Club is looking at making sure that we're feeding our people that need help. But how to connect them all is difficult. And I'm finding that my time is now really constrained too. So if there was a way that the county, especially for seniors, but for other people that are, I'm using the right, food insecurity, how can we tie all that together? And because again, in my worldview, this is going at least through December, if not longer.
Yeah, I appreciate that that question and those thoughts. You're correct with our Meals on Wheels, our home delivered meals program, that is an ongoing funded program through the federal government and the state. And of the county for us. And I know that they would be interested to hear from you and to hear how they could connect Millbrae volunteers with their program. So we can reach out to you to help in that area.
This will sound really lazy on my part, but if you can give me something that I can turn around as quickly as possible and get it out there, then I might actually get off my to-do list. If I have to do a lot of the writing myself, it gets into my pile. And I don't want to admit to being lazy. I'm just finding that I'm treading water and I'm not getting everything done I want to do.
Sure, and we will reach out to you.
Okay.
In the chat room, is that correct?
Yes, we actually have 2 statements from the chat room. Janet Borgens from Redwood City points out that Redwood City has provided 9,000 lunches to seniors, and that is above and beyond the number that was presented earlier. And Adam Rack from San Carlos asks, is it possible to obtain a list of the restaurants by city that are in agreement and are serving these meals?
Thank you. And Janet, you're correct. What we were showing were our Older Americans Act funded providers, and I don't believe that Redwood City is part of that. The question regarding the list of restaurants, at this time, because we are not wanting people to call restaurants directly, it becomes very confusing. We have not been releasing the list of restaurants. Again, this is, we've been doing this for 2 weeks, and as this program, if it does get continued beyond June, we might be looking at different responses to that question.
All right. Are there any more questions? I don't see any. Mr. Norris?
Yes, we actually just had a raised hand from Councilmember Gauthier. You can unmic yourself.
Yes, Lisa, thank you for the information. I've been working with our senior committee, a senior advisory committee, on reaching out to our seniors, and we've been using the voter registration data, and we found that many of the seniors that are listed on there, their cell phone numbers have been disconnected. So it makes it very difficult to reach out to them. We're going to send out some postcards to all of those addresses to try to get a hold of people. But I was wondering, is there another way to contact seniors within the community? And then question number 2 for you, do we know how many seniors may not have a cell phone? And is there a way to, I know that the county at one time had free or subsidized cell phones for individuals that made a certain dollar amount. And if that is still the case and those cell phones are still available, could we make those available to those seniors who don't have a way to contact the county?
Thank you. So we're trying to do the best that we can in doing as much outreach as possible, and it's really through our interfaith communities, our local senior centers, local city centers who are aware of the older adults, because you're absolutely correct. If there are no cell phones or other ways of reaching out, a lot are just landlines, and maybe a lot of older adults don't have access to the internet and can't go onto websites and whatnot. So those are our challenges that we constantly, and that's why the more that we can get out to folks like you who can get the word out, we're really pleased to do that. As far as the cell phones, I will need to look into that. I'm not familiar with that program, but I can do some research into the cell phone opportunity for older adults.
We actually have a quick follow-up from Vice Mayor Schneider.
Hi, thank you. You mentioned seniors, you're seeing seniors you've never seen before. Some of them, I think, have figured out how to reach out to you, but I think that we've got a number of people who have never had to ask for help before and are ashamed to ask for help. And some of them may not know how, they're not connected through the internet. And I'm hoping that you greater minds have a way to make sure that we're trying to reach them and make it it's not shameful, but make sure that they understand that it's not shameful.
Yeah, absolutely. I received an email from one of my staff who is volunteering to be on the line, who said that she talked with a woman who was so pleased with the program. And she said, I never thought that I would be the one calling in to get help. And I thought I would be ashamed. And now I'm feeling so good about this. So just trying that word out more, that this is just a way for us to help during these very unprecedented times. And so we're continuing to try to get out as much, like I said, in the media and through local contacts as we can.
Great. I think I don't see any hands up. I don't see anyone in the chat. Can we move on to the next item? And that is the county update. Mr. Callaghy. Thank you, Lisa.
Thank you, Supervisor Canepa. And just let me also recognize Lisa. She's done such an incredible job on this program and helped so many people. Just so proud of her and all her staff for all she's done. Thank you, Supervisor Canepa, members of the council. I'm fortunate enough to talk to the council members throughout the county, on all the elected officials throughout the county several times a week. So I'm going to keep this brief and see if you have any questions. Just a couple items of interest and a kind of a preview of what I'll talk about tomorrow. On the PPE front, we're having still great difficulty finding the N95s, which are the medical grade masks. We have a lot of the KN95s, but we cannot get a fit on those. This is a mask that also the government of the state of California ordered in bulk. They're great for other purposes, for staff that are not on the front line in a hospital setting, but for those who need a medical grade, they will not work. So we're trying to work through that problem. Just a quick update on FEMA, who's also, told us up front that they would give us 50% of the submittal that we put in. We were 7th in line in the country, and we were depending on, getting that money back. We expected 50% of it, 21 million coming this week, and we were just notified today that it would be 40%. So they dropped it 10%, and that 50% would have gone to 75 later on. So we can see where this is going, and that the FEMA will not have enough money to reimburse counties like we originally thought, and we'll keep you posted on that. In regard to beaches, there has been some questions from specifically Half Moon Bay and Pacifica about the new orders as they relate to beaches, and the fact that they're open to everyone between the hours of sunrise and 11 p.m. or 11 a.m. and then they're just for the locals. Really 11 a.m. to 5. And there was a question about the parking lots. And the orders read such, and this will all be informing your city managers, that you can open the parking lots if you want. You can open them anytime you want. There was a you may close them type of situation. You can open them. We can also do away with those hours if you want. We did that primarily for the benefit of the cities along the beach, so there wasn't some crowding, but I'll be notifying the city managers of that tonight or tomorrow. And then just a quick update on the malls. We found a little flaw in the state's orders that at the malls, and I think this is certainly of interest to San Bruno and Daly City and San Mateo, that the way the orders are written from the state, which we follow, are that the perimeter stores around the mall can open and do curbside. It doesn't make any sense to us that, for example, GameStop in Hillsdale Mall, located on the second floor, that someone couldn't call in there. That employee could walk downstairs by themselves, walk outside to a loading zone, pop the trunk of the vehicle and put it in there. It just didn't make any sense. We would get more people back to work. We'd get more tax money rolling in to our cities and county. So we put Jerry Hill on that. He is all over that issue with the state right now, and we hopefully will expect a positive result from that. And I'll be updating you all tomorrow if that does come to fruition. So with that, I've got a couple other items I'll update you all on tomorrow. But with that, I'm happy to take any questions. And I just want to say thank you all for what you're doing out there. You make our jobs a lot easier by all you're doing in your cities.
All right, thank you, Mr. Callaghy. Do we have any questions for Mr. Callaghy?
One.
Ms. Borgens. If you can unmute yourself, Janet.
I'm muted, sorry. I want to just thank Mike for all of the work that he has put in all of the meetings. I've been on the majority of them, and it's just an amazing amount of information. And thank you for getting on Jerry Hill about that issue, because the sooner we can open up as a community, the better. And if there is a way to do it, maybe we just need to bring it to light. So thank you for recognizing that.
Thank you, Janet. Appreciate that.
Are there any additional questions for Mr. Callaghy? Are there any messages in the chat, Mr. Norris?
Seeing no messages in the chat.
All right. Thank you so much, Mr. Callaghy. Really appreciate the update. Okay. You have a good evening.
Okay. You too. And I'll see you all tomorrow.
Okay. That brings us to the Public Safety Power Shutoff update. Chief Dave Pucci and OES.
Yes, thank you, Supervisor Canepa. This is Kevin Rose, San Mateo County Office of Emergency Services. I'll provide a background and update conversation first, and then have Chief Pucci provide some contact information and additional comment from the fire chiefs. From our April meeting, rightfully so, ESC members had inquired about the pending summer wildfire and public safety power shutoffs. So what we wanted to do was provide a background of the October events that we had gone through, sort of the debriefs that we had held for our own purposes, and then also to pass along to PG&E. What PG&E is working on to continue best practices and improved services for 2020, and then some real up-to-date information we received from actions that are taking place with the California Public Utilities Commission, and then of course the county with status update on our de-energization plan. So as everyone recalls, last year, October, we had 3 events. October 9th, that went for about 36 hours, a Wednesday through a Thursday and Friday, affecting 15,000 customers. Customer base is essentially 2.5 people. So that's 37,500 folks that were impacted. This was the coast. This was Pescadero de Montera, just south of the tunnel, including Half Moon Bay, Portola Valley, and Woodside. PG&E did dedicate 1 community resource center that the county fought for to be placed at Half Moon Bay. And the event itself, as mentioned, 36 hours, and it was our first exposure to what was going to happen. The next event was October 24th to the 25th. It was a 20-hour event impacting 2,500 people. This was mostly in the coastal foothills that included Portola Valley, Woodside. There was 1 community resource center that was at La Honda. The big event that impacted everyone was the October 26th, the 29th event, 72 hours. We were just on the verge of this becoming, everyone becoming significantly impacted. This was a Saturday to a Monday and Tuesday. 143,400 individuals were impacted. This was the entire coast, Pescadero to Pacifica, including Half Moon Bay, Portola Valley, Woodside, even impacting the Bay side, South City, San Bruno, Burlingame, Hillsborough, San Mateo, San Carlos, and Redwood City. We were fortunate enough to get 4 community resource centers at Pacifica, San Mateo, La Honda, and San Carlos. We were also on the verge of an October 29th event that at the 11th hour was canceled. This was of significant concern because it was going to impact 33,000 of the same individuals that had already experienced the 72 hours of power shutoff. Fortunately, the event had ended. Unfortunately, it was a notification that prevented businesses from reopening in a timely manner to try to gain back the customer base that was lost. So after the events had occurred, OES convened an agency debrief with county departments, OES staff, emergency operations staff, cities, education, special districts. This is information that was collected, gathered, and shared with PG&E management and representatives that made its way into the PG&E After Action report. Successes that we had reported on, we were very fortunate. The county's information sharing, county manager was able to get to us before the city managers with a plan for messaging that we were going to interact and advocate for that ended up being the plan of attack for the October events. County would now announce the large event itself to the entire residency base and SMC alert members. And then cities would customize the messaging accordingly to help out their own residents. That was to prevent duplication of effort and to really amplify the message that was coming from PG&E. There was also success with regards to the maintenance of our critical infrastructure, the utilization of SMC alert, social media, even PG&E with the 3-time daily phone calls that they were provide to us that we in turn were able to make available to county departments and cities in our own calls. The opening access to the PG&E portal with its maps, and an embedded PG&E representative in our EOC that was provided us with real-time fast information to help us out. And the great success was that the Tom Lantos tunnel was not impacted during any of these events as it easily could have been. Some of the improvements that were commented upon was the fact that unfortunately this was a moving target for when the actual time of de-energization and time of re-energization were to occur. Even though from the first couple October events, re-energization was fairly quick within 24 to 48 hours, per PG&E, we still had to put out to the residents a message that it would take up to 2 to 5 days, meaning that they had to plan accordingly as cities did as well. The PG&E website unfortunately crashed, and then the late notice of the cancellation of the October 29th event that, as I mentioned, impacted businesses and even city and county services. And then, as an editorial, the PSPS events themselves. Except for Sunday, October 26th to 27th timeframe, where we did witness some heightened winds, there was nothing really we noticed even real time that matched PG&E's own 6 criteria that activated this event. However, the events did go forward and we were able to respond accordingly. So PG&E, with what they are doing essentially is continued best practices from 2019. The embedded PG&E liaison into the county EOC, a PG&E liaison point of contact in addition that would be synced up to their Wildland Safety Operations Center and their EOC in San Francisco. They did agree to continue at least 2 times daily regional calls and 1 high-level state call. So they will at least maintain the three times calls that we preferred and requested. And essentially secured government, what we think is going to happen for planning purposes, and open public portals. What is going to happen is happening. These portals with updates that come to us 24 to 48 hours before the event, unfortunately, so we can plan accordingly. And then the actual vetted information that makes available to the public on the public-facing event. And they are going to be making improvements to the real-time information. For corrective actions that PG&E will be implementing for 2020, what they've promised is to utilize better science and data to reduce the public safety power shutoff footprint through modeling, technology, and targeted system hardening. This is an advanced increase in vegetation management. Sectionalization, which is essentially they'll be able to switching and rewire power accordingly. This is something that was actually practiced during the first event because the Tom Lantos Tower is powered by wiring north and south of the tunnel, and PG&E was fortunate enough to reroute power to the north end that was not impacted to maintain the tunnel being opened during that time. Better weather data and better map modeling. They're also looking to shorten the duration of the PSPS events by having more field crews to be activated for both the de-energization and the re-energization, almost doubling of their helicopter fleet from existing 35 up to 65. They're going to add 2 airplanes, and then infrared equipment for night inspections. As everyone remembers, basically it was daylight was the time frame for them to be able to inspect the lines. Now they're going to be able to have infrared equipment to do so. They will provide more timely and accurate communications with regards to the start and end time. The website capacity they've increased significantly, placing it in the cloud, improving the alerts that go out to individuals. And then they're also working to deliver more assistance to the access and functional needs, vulnerable populations and residents, both before, during, and after. Now, what is occurring at the California Public Utilities Commission, this is the state governing authority for the 3 large utilities. This is the organization that basically granted all 3 utilities to be able to activate the PSPS events, is that a few things have occurred. The first is that there was a joint motion for emergency order regarding de-energization protocols during the COVID-19 pandemic. This was a filing that was made by the California State Association of Counties, of course, of which County of San Mateo is a member, as well as County of Santa Clara, City of San Jose directly, some rural counties, and various local energies. We do have partnership within the CSAC and representation with regards to this emergency filing. And essentially what it wants to do, in essence, is allowing the counties and cities with a population over 100,000 to request an exemption of a PSPS based upon the impact of the COVID-19 event on their communities and their residents. What it also is requesting CPUCs is to place within this emergency order strict requirements and data for the utility to justify the PSPS event, comparing the existing pandemic and the prioritization of the PSPS event. Number of cases, number of hospitalized with COVID-19, increased medical risk to the community from the PSPS, how well PG&E is able to respond, the anticipated loss of revenue to individuals and community, the impact to the AFN community, impact to critical facilities, the utilities, and this is everything the utility must ensure and provide to us, ensure all critical treatment facilities and essential businesses remain generated, and written permission from the county and the cities with population greater than 100,000 that essentially this PSPS event is warranted, and more so based upon the existing pandemic that we're experiencing. Again, this is an emergency filing that has gone before CPUC for review. And essentially CSAC, the California State Association of Counties, has included in comment for an upcoming May 28th meeting, where the May 28th meeting is actually going to be reviewed. And mind you, this emergency order request is just that, a request to the CPUC. The CPUC has created its own decision on what's called Adopted Phase 2 Guidelines for the 2020 PSPS event that is going to this May 28th event. For CPUC, COVID-19 is separate. They haven't addressed that yet. But what they are wanting to do is make sure that there are more stringent requirements from the utilities on the decision, the duration, the information, the protection of residents, participating exercises during the off-season with local governments and agencies, coordination and input from designated working groups and advisory boards that would include membership. Don't know the details of that, but these are included in the draft Phase 2 guidelines that will be taken up for consideration. These are things we are hopeful that go in, that our voice has been included within feedback provided to CSAC, and we'll definitely keep the ESC membership up to date as far as the emergency order request, as well as the Phase 2 guidelines. As far as what we do know and are able to take handle of ourselves is our own county's de-energization plan, also known as the PSPS plan. In 2019, as I mentioned, we were fortunate enough to have our communication strategy in place based upon our communications with and meeting with the city managers in the county. That was executed fairly well. And then additionally, OES had developed a draft plan with initial department reviews for response. We were fortunate that the October responses themselves were more information-based, that we were already at the ready from an all hazards planning perspective, and that the draft plan was really more of an icing on the cake. For 2020, what we've done is updated the existing draft plan based upon the October events of what we experienced. County departments, cities, agencies, and other stakeholders that we gathered post-event, and that we've been working in the concert in the background, even while responding to the COVID-19 event, with the county manager's office, with the emergency operations center, where we have future planning concurrent events as an objective, and also somewhat on the fringes of the county's long-range planning, the second disaster planning committee. So the draft plan right now is going before departments for review in the coming weeks, and then will be shared with your cities shortly thereafter for review and also consideration within your own planning as we go forward. So that's everything that we have updated leading up from the actual October events till now. And I'll hold on questions. I would ask Chief Pucci if he could go forward with a letter that was submitted that we will share with the ESC membership, and then also perspective from the fire chiefs. Chief Pucci?
So before we do that,
thank you, Kevin.
Hold on one sec. Before we do that, before I introduce Chief Pucci, I just want to tell you, a couple weeks ago, I did receive correspondence from Jess McGallness, who I think is the head of the fire chiefs. And one of the things, and maybe Chief Pucci can clarify for us, is they've asked this board to potentially take some action. I just wanted to see through Chief Pucci if that's changed, and what is the ask today from the chiefs. Chief Pucci?
Thank you, Supervisor. Dave Pucci with Robin City Fire Department. At the last meeting, we discussed the county fire chief's concern about a PSPS in the context of the COVID-19 emergency, and we talked about some of the reasons for that. Since that time, the county chiefs have been meeting several times a week to deal with the COVID emergency, and we have discussed what it boils down to is that we feel that the risk of having a PSPS during a shelter in place provides greater danger to public safety than the potential risk of a wildfire in San Mateo County. In San Mateo County, we have several things going for us when it comes to wildland fires. We have different weather conditions, less frequency, but that's not to say that there's not risk for us, and we do deal with that. We also have a tremendous amount of resources available to us should we have a reported wildfire in the county.
Hello?
I think he went off.
Yeah, Supervisor, looks like Chief Pucci is not here. So what I can do is fill the void in time with some questions. Before we get to the hands, actually, I'll go in reverse order and look at comments that are provided. Oh, Chief is back. Go ahead.
Sorry, I'm back on. That was the worst possible timing. Sorry about that. So the county chiefs, I would support CSAC's efforts to limit, as is possible, any PSPS in San Mateo County. I'm just thinking about the food shortages that have already occurred, the possibility of shutting power down for several days and food spoilage, and our at-risk community members who are already struggling with food. In general, we just think that the PSPS poses more of a risk to public safety than a possibility of a wildfire. So with the letter that we submitted to Supervisor Canepa, I think probably the best path forward with the approval of this council would be to submit that letter to CSAC, maybe along with a letter from this council stating that we would support the county's option of opting out if that was our decision.
Okay. Thank you so much. I think we have, Kevin, if you could start, we have Davina Hurt, Janet Borgens, and then from there we'll move on to the chat. Davina?
Yeah, sorry, that was a mistake. I don't wish to speak or have a question. Thank you.
Right. Thank you, Ms. Hurt. Ms. Borgens?
Thank you. I do have a question. First of all, I want to thank you for both of you for moving forward with the PSPS discussion. I do have a concern about the fact that so many of our workers are now working at home. There is a different element here. So when you do shut off power, they lose the ability to make a living. Our children are studying at home, and there are still some college students that are doing that. So therefore, they need that power. So I really appreciate the fact that we're considering supporting a document that says we could opt out. And I trust our fire chief to know the data, to follow that data, to know if there will be a climate incident where we may have to definitely shut down power. Just doing it because it's a maintenance, I just think unless it's an emergency maintenance, I would really like us to revisit this and have the ability to control it a little bit more for San Mateo County. So that would be my vote to move forward and give our experts the ability to know when that is the correct time.
Okay. I see Ann Schneider. Ms. Schneider?
Thank you. Sorry, I had to unmute. Thank you, Councilwoman Borgens, for having that perspective. Millbrae didn't go through a power shutdown, so I would tend to lean towards what the officials from those areas that were affected by that go through, because I don't have firsthand experience. That said, lately PG&E has been running a lot of helicopters and or airplanes checking lines. The minute they start doing that, our next door community, which includes San Bruno, Burlingame, and Pacifica, starts lighting up. My one request, even if we do opt out of power shutdowns, is that we use our SMC alert system to tell people that PG&E is doing a maintenance check by air, and so people don't get scared. I'm just worried that people will get excited, and if we're not open with them and transparent with them, they'll start to not trust us. And right now we need them to trust us, whatever we do.
Yeah, thank you, Vice Mayor Schneider. In fact, actually, we did have to send a couple SMC alerts to Coastside residents during the October 2019 events because of that very same effect. And so we would include that within our communications and messaging about PG&E crews being in the area, the helicopters, and now potentially even the planes.
You know, one thing about the messaging too, somebody may live in Millbrae but have family in Montera. So sometimes don't be afraid of sending it a little bit bigger when it's this important.
Oh, absolutely. Yeah, that's a good point as far as we do send beyond the breadth of where is going to be the impacted area, and we'll continue to do so.
Thank you.
All right, there's a chat by Sue Varlaus. Does PG&E have a plan to provide generators for the service centers? Their site didn't work and we had to move to our community center, and we borrowed generators from 2 contractors to allow for cell phone charging.
Yes, thank you, Councilwoman. In fact, in the CPU pending decision, they do request power generation to community resource centers by PG&E. Also, in one case, you were fortunate, rather than tented CRCs, they are requesting fixed facilities with the infrastructure in place, or if not, PG&E to be able to help complement that infrastructure so that power generation can be provided.
All right, are there any additional questions?
Again, from the councilwoman inquiring about cities only over 100,000 population. Indeed, the smaller cities are shut down. The county has your back in essence of basically requesting that waiver or asking for it. With an event occurring, OES, we're available 24/7 with our EOC activation. By all means, cities reach out to us and we'll advocate for you. And then another point, Mayor Sylvester, thank you. I didn't have a formal presentation with the information coming so quickly as it did even today, but I will provide my notes to everyone and can answer questions with some of my cryptic writing.
So what's the direction and the will of the council? Obviously, this isn't an action item. You know, I don't know if there's, you know, direction that any of the members want to provide and maybe seeing this on the next agenda. Janet, I don't know what your thoughts are. Or...
Well, I personally would like to, and I think for my citywide, I would like to see us move forward with the recommendation to let them submit that letter, support their letter of request, and let the experts make the decision based on the best data they have before them, following that data, making sure that if in fact there is a weather change or there is an incident where they feel absolutely we need to be on that rotation, be in sync with where PG&E gets their data. Make sure that you are looking at both, because right now shutting it down just for the sake of shutting down the power, we had one just recently, and we had people coming in saying, we never received a call that it was being shut down. Now, I don't know if they did, but there were quite a few of them that said that. And it was all up in the areas where we have a lot of kids in school. So just having the concern that we just don't know, there are so many unknowns with this still shelter at home in place. Even though some can go back to work, some are not. I would like to support our fire chief in submitting that.
Through the chair.
Yeah, Mr. Medina.
You know, first, I think it's important for legal counsel to take a look and review this. It's always a concern where I come from is that when you're directing and you're saying we want opt out, and then that somehow can come back to the county in some legal matter to say you've asked for it, and unfortunately we had some repercussions. So I think we need to be very balanced on that. That's the first thing.
Sorry.
Oh no, that's okay. And then I know you feel the same. And then also with this being an update and a Q&A, I don't think it's appropriate to take action that would need to be placed on the June agenda where it's more of an action meeting with the other elements. So, but I think that legal counsel does need to review and see if there's any concern.
All right, well said. Are there any other comments?
And through the chair, Supervisor Canepa, to Mayor Medina's point, we will provide an update of what we hear from CSAC with regards to the CPUC May 28th meeting.
Great, thank you so much, Mr. Rose. That brings us to public comment. Are there any public comments or questions?
No, we do have another follow-up from Vice Mayor Schneider.
Okay.
I'm sorry, I thought you were asking us for our comments. When you're ready, Supervisor.
Okay, that'd be great. So, before we go to next meeting, are there other board members that have comments at this time?
Are you talking about under public comments and questions?
Yes.
So I'm assuming we're asking if there's any public comment.
Yeah, there is no public comments or questions. But one of the things that, I want to know if any board members have comments.
I'm sorry, not for myself.
Okay.
Thank you.
For anyone else?
Supervisor, I do have one.
Yeah.
I had just found this, oh golly, it didn't disconnect me. It's called Zoomers for Boomers. It's a program for young people to help bring food to seniors who don't want to leave at home. We, the teenagers in the summertime get bored, caused a fire, burned down our rec center. Well, we also had our very first large apartment fire a couple of weeks ago. And then last week, 2 teenagers again set the place on fire. So I have a concern, I brought this up on the long-term planning call, that our teenagers come this summer when they I'm not saying these are bad kids. Good kids can get into trouble too. That I hope that we are all thinking of programs that might keep our young people engaged. On top of that, at least our high schools here no longer have the community service requirement. So we're finding, like I'm an advisor to the Millbrae Leo's Youth Club, we're finding fewer kids willing to commit to doing community service. So I am hoping maybe with the schools, they might think about re-engaging the community service aspect, and we collectively come up with programs to keep our teenagers and our tweenagers engaged this summer so that nobody else has unintended arson happening or anything else bad that can happen. But I really like this Zoomers for boomers, and it's active in San Mateo and Burlingame and another city south of us. So it seems like a cool program to look at that can also help augment services in the time of COVID. So I just wanted to throw that out there.
Great, thank you so much, Ms. Schneider. Are there any additional questions? Seeing none, I'll adjourn the meeting, but our next meeting.
Supervisor Canepa, sorry, Mayor Sylvester.
Oh, the fine mayor from Daly City, Mr. Sylvester.
Thank you, Mr. Chair. You know, I'm hearing very, very good ideas from the various cities. And, you know, being that we're all in this together, would it be a possibility perhaps that we can share some best practices as to what folks are doing? I think we can learn from each other, and I think it would be a good idea. Maybe, I don't know, 2 minutes, placing it onto the agenda. Maybe all the cities don't have to do it all at once. So maybe an agenda item for the next 2 meetings or something, and we can share some best practices as to what we all have done. It's just a
I think it's a great idea, and I will move forward with that. With that, Marie Chuang, Ms. Chuang.
Hello. I'm so glad that the mayor of VIII City mentioned regarding the good practices, because we also had discussion at the CCAG board where the CCAG staff have on their website compile all the best practices that the city's council members have been sharing, and there is resources there. So I wonder if we can consolidate that, and that would be a good place to go to.
Okay, thank you very much, Ms. Chuang. Are there any additional questions? Seeing none, I know you want to stay for another hour, but we'll adjourn this meeting, okay?
Thanks, Supervisor.
Thank you.
Thank you, Supervisor.
You guys have a great Thursday night. Thank you.
Be safe. Have a
Thank
good
you,
Memorial Day.
Supervisor.
Thank you. Thank you.